Welcome back to the Arise interview, where we speak to the newsmakers as well as ordinary people doing extraordinary things around the world and featuring the voices at the heart of the stories. I'm Charles Aniagolu. Now, in Nigeria and around the world, millions of people are still waiting for healthcare facilities to reach their communities and to be accessible to them. Millions are today raising their voices, calling on their leaders to make bigger investments in health and to make commitments to help move the world closer to universal health coverage. Today is, of course, the day that the United Nations has proclaimed as International Universal Health Coverage Day. The UN is urging countries around the world to accelerate progress towards universal health coverage. The idea that everyone everywhere should have access to quality, affordable healthcare as an essential priority for international development. The theme for this year is Keep the Promise. It follows a UN high-level meeting in September where world leaders endorsed the principle of universal healthcare. But how committed are countries like Nigeria to making bigger and smarter investments in health? We'll speak to an expert in a moment. But first, here's the World Health Organization talking a bit more about universal health coverage.
You might have heard people talking about universal health coverage, but what does it really mean? Think about it this way. What do you need to get, be, and stay healthy? Can you get help from a well-trained health worker? Can you get treatment that helps you get better and is safe? Can you get the medicines and other health products you need? Who will pay for it? Are there policies in place to ensure the services you need are available to you, your family, and your community next time and every time? And does your government have accurate information about the whole system so they can make the right decisions to keep everything working the way it should? Good health needs people, services, products, finances, policies, and information. And it needs all of them to work together, even in times of crisis. And good health systems don't just treat sick people. They help to promote healthy living and prevent people from falling ill in the first place. The World Health Organization is working around the world so that all people and communities receive the quality services they need and are protected from health threats without suffering from financial hardship. That's what we call universal health coverage. So, here's to health, for you and for everyone.
Well, for more on this, I'm joined now in the studio by Dr. Jafar Alawode, the Country Director for Health Policy Plus, which provides technical support to governments to help them progress towards universal health coverage. Thank you very much indeed for coming in.
Thank you very much.
I haven't murdered your name too much.
That's why it's Gafar, yes. Yeah.
Gafar.
Close, yeah.
Very good.
Yeah.
Well, thank you for coming in.
Thank you very much.
First of all, tell us about your group, Health Policy Plus, for which you are the Country Director.
Okay, so thank you very much. Health Policy Plus is a United States Agency for International Development funded a project which is aimed at providing support to developing countries to have a better health, a better policy for better health. In Nigeria, we work in a number of states to support existing policy trust of the government. We don't come here to start our policy of our own. There are a lot of interesting policy trusts that the Nigerian government has put in place, but we just provide technical support in area of a busy care provision fund, which is a very interesting policy trust, which has potential for changing the health financial landscape in Nigeria. Nigeria is pushing health insurance decentralization. We provide technical support in that area, and we support the country to strengthen the primary health care. You agree with me that primary care is the cornerstone of health system strengthening, and ensuring that Nigeria is actually spending more on health in terms of supporting domestic resource mobilization. So that's our organization, that's what we do.
So, I mean, universal health coverage then would fit in as a policy priority for your organization at both a national and a global level.
Absolutely. Absolutely. So you talk about universal health coverage, and from the intro we see here, it's about ensuring that everybody has access to the quality health care without suffering financial hardship in the process of doing that. So the Basic Care Provision Fund that we support is a form of an intergovernmental fund transfer from the federal to the subnational level to ensure that the fund reach health facility, because part of the problem is that our health facilities are poorly funded, and when they are poorly funded, they are not able to provide the needed care. So when people get there, they are not able to access the care. And on the other side, it's not only about funding the facility, it's about paying for the services themselves in terms of ensuring that people are able to access basic care, package of services that government has already paid for. So that is very crucial, and it's going to play a pivotal role in accelerating progress of Nigeria towards achieving universal health coverage. So we support that. That has a direct implication for universal health coverage. Talking about health insurance decentralization, let me take you down a bit to the memory lane. One of the reasons why Nigerian health insurance has really not progressed, there's all the available figures are pointing to the fact that less than 5% of Nigeria are insured, and those that are insured are those that are in the formal sector, leaving the teeming population of people in the formal sector that are not able to access the care.
So I don't mean to interrupt you. So a country like Nigeria, then, yoked down as it is by numerous competing priorities, is not really moving towards universal health coverage, is it?
So looking at the existing statistics, I would say no. We're looking at all existing parameters that indicate whether we are making progress, because one of probably the single most important parameter is that what's the proportion of people that are covered by any form of a financial protection mechanism for health? And when we're talking about financial protection mechanism for health, we're talking about health insurance, for instance. We are talking about probably direct government financing, because it's not all countries that operate health insurance. But whether we call it insurance or not, we are talking about people don't need to dip hand in their pocket assessing the care. That's the single most important parameter to show that whether we are making progress towards universal health coverage. So Nigeria is not there. But at the same time, I know the question will still come, but at the same time, the universal health coverage celebration this year is important for two important reasons. One, we have something to really be worried about. Then two, we have something to be excited about. Let me start about what we may need to worry about. Every 5 years, they conduct a National Demographic and Health Survey. We tend to provide the scorecard of the performance of the health system across several key indicators in terms of number of children that are dying, number of women that are dying as a result of giving birth, and all sorts of things. Unfortunately, that scorecard is not very good in terms of performance. For example, as a case in point, it shows that more children actually die during this last review period than the previous years. A number of indicators, even those that we improve, are just marginal improvement. You understand? So there is something for us to be worried about if more of our children are dying.
Yeah, no, of course. So, but in those circumstances, then, is it even realistic, remotely so, for some developing countries like Nigeria to be talking about universal health coverage? I mean, given the unsustainable costs involved.
So the interesting thing about universal health coverage is that it's aspirational. Aspirational in the sense that in the actual sense of it, no country has actualized the dream, because we are talking about 3 dimensions: covering everybody, covering all the services, and covering all the costs. It's actually not, but it's something that all the country will continue to make.
Yeah, but I don't think people would have a problem if they go to a hospital and see how well equipped it is, and based on the amount of money you receive. I mean, you can't say, for example, that everybody must pay 1,000 naira when they're making, some people are making 1,000 naira a month. Yeah. But if you said that based on your salary or whatever it is, everybody's going to make a 2% contribution. So if you're making 1,000 naira, you take 2% of that and contribute. The sort of thing you have in the UK, for example, where you've got the National Health Service, and everybody has access to the National Health Service. In fairness to the point you're making, you don't have that in the United States. That's been part of a big problem there. But then people earn a lot more in terms of their salaries and can independently insure themselves, and they have a lot of options as far as that goes. But as far as Nigeria is concerned, the process, as you're saying, it's aspirational, but it's extremely gradual, isn't it?
Absolutely, it has to be. It has to be gradual. There are a lot of factors to be considered in the first instance. You know, the ability of the country itself to pay for the health of its people is very germane here. Let's look at it.
Yeah, but part of what you espouse, and I don't mean to interrupt you, is not just the availability of it, but coming up with innovative ways to make that accessible. In other words, a contract between the government and the people, where you say, pay a percentage of your income, and we will provide, you know, we will make sure that the hospitals are well equipped. We will also make a contribution ourselves as government. You see what I mean?
Don't forget something, the context matter. We're in the context in where the majority, the larger percentage of the population is in the informal sector.
Yeah.
So this idea of bring percentage of your income, there are the steaming population of Nigeria that you don't even know their income. You don't know how much they earn. They are not. They don't have bank accounts and other stuff.
No,
like
I understand that,
Yeah.
but we're not seeing from the government any concerted effort, any sense of dramatic urgency to say this is a topic because the more you talk about it, the more the government makes it a priority, the more people see hospitals being equipped with the little the government is actually putting in there. The more people are likely to say, okay, I'm a market woman and maybe you don't know how much I make, but I'm still going to make a contribution.
You're absolutely correct. And earlier on, I said there are two things to be, there are two things, something to be worried about, and that's the scorecard, and again, something to be excited about that you might be interested in. Policymakers in this arena have been pursuing certain policy thrusts for almost a decade now. They call it Basic Care Provision Fund, which is an intergovernmental fiscal transfer. Don't forget, in our context, which is a federal setting, you understand, it's very difficult for one layer of government to give directive to other layer of government that you must do this, you must do that. But there are innovative ways by creating incentives. So what the policy trust, which is a very exciting, which actually took off this year, that Basic Care Provision Fund is a earmarked fund, 1% of consolidated revenue.
Okay, let me ask you to just hold that thought. We'll come back and you'll keep talking about that. We've got to take a break. You're watching the Arise interview. Plenty more still ahead as the UN marks International Universal Health Coverage Day. Stay with us. Welcome back to the Arise interview. I'm Charles Aniagolu. Now, the UN is marking Universal Health Coverage Day today. This means that in theory, every person on Earth should have access to sufficiently qualitative, preventive and curative healthcare without suffering financial hardship. In practice, of course, that is a goal that so far is nowhere near being achieved. In Nigeria, for instance, the country still has an exceedingly long way to go on the road to universal health coverage. Every year in this country, millions of people are pushed below the poverty line by health care costs because the country lacks effective financial protection mechanisms. Experts say that President Buhari's ambitious plan to lift 100 million people out of poverty is dead even before it begins because of the threat of a lack of access to quality health care and financial protection mechanisms like health insurance. We'll talk about all that in a moment, but first, here's another short video about the idea of universal health coverage.
Think of universal health coverage as a pooled fund, and this pooled fund can come from a variety of sources. So it can come from general government budget, it can come from compulsory insurance contributions, and it can come from voluntary health insurance. And then these funds get used to address the three dimensions of universal health coverage. And these three dimensions are, number one, the proportion of people covered, number two, the proportion of costs covered, and number three, the range of services that are available. And of course, policymakers need to make decisions, and of course, they need to make trade-offs between these dimensions. And they make those trade-offs in a way that maximizes the extent to which people's healthcare needs are met and avoids catastrophic healthcare expenses that can lead to impoverishment. And so the idea of universal health coverage is really that it's an idea that is in contrast to its alternative. And the alternative is that healthcare is just another good or service that can be dealt with in the marketplace. Now, there are some goods and services, and in fact most goods and services, for which the marketplace is excellent. healthcare is just not one of them. So the price and quantity of iPhones that get bought and sold, fine, works really well in the marketplace, leave it there. But there are circumstances and there are goods and services for which markets tend to fail. And healthcare happens to be one of the best examples of this. Now, I'm going to create an entire separate video that gets into the economic theory as to why it is that healthcare markets tend to fail. And in that video, I'm going to talk about things like adverse selection, information asymmetry, externalities, and supplier-induced demand. All you really need to know for now is that the economic theory predicts that healthcare markets will fail. And the empiric evidence, the data, the natural experiment that's already been done in the world confirms just that. A healthcare system that relies too heavily on private healthcare service provision is not only extraordinarily expensive, and the empiric evidence demonstrates that, but also at a population level produces very poor health outcomes, and the evidence and the data support that conclusion as well. Now, I'm not saying that there's anything wrong with private healthcare services. I have private healthcare insurance, but I'm delighted to live in a country where if I were to lose my job or fall into financial difficulty, that my family wouldn't be in harm's way. And if I feel that way, how much more must it be the case for small business owners and entrepreneurs who really form the backbone of the economy? In fact, universal health coverage is arguably one of the best things that you can do to encourage the entrepreneurial spirit and to grow the economy and create jobs. But of course, that's not the reason why it's a beautiful idea. The beautiful thing about universal health coverage is that it protects the poor and the vulnerable and prevents people from falling into poverty. In the US, for example, the number one reason for going into poverty is unforeseen healthcare expenses. Now, of course, the scope of services that any given country can afford to offer its people is a function of what that country can afford. And so a lot of thought needs to go into identifying the most cost-effective combination of services to meet the needs of people, given the financial constraints that all countries work within.
And still with me in the studio, Dr. Ghaffar Alawade, Country Director for Health Policy Plus, which provides technical support to governments to help them progress towards universal health coverage. Thank you very much indeed for staying with us. And you were talking about whether enough is being done to prioritize healthcare in Nigeria. You were talking about the 1% investment that Nigeria is making.
So as part of the policy trust that organizations support the government to put in place, is basically a provision fund, which is, like I said, it's 1% of the consolidated revenue of the government, earmarked by law, that the government started making provision funds since last year. This is one of the well, there are examples of, they call it intergovernmental fiscal transfer. Part of what it does, remember, financing the primary health care is not the primary responsibility of the federal government. This money is to incentivize, part of what it's supposed to do is to incentivize the subnational level government, state government, for instance. They have their own counterpart, funding to contribute as well. They call it equity fund. Almost all the states in the country has passed what they call state social insurance scheme, and part of that scheme is equity fund. The money that is meant for supporting people that are not able to pay premium for health insurance. So that's part of it, is to incentivize the state to do more on health, because the federal cannot give a matching order that all the states, you must spend so much on health. So that's one of it. Another one is to ensure that even the proportion of a fund that federal and the state is spending on health in terms of a percentage of a government spending that is going to help. At the federal level, it's only like a paltry 4%. At the state level, in most of the states, it's not in any way better than that. But the benchmark is 15%. It is in this Abuja here that head of government come together to agree on spending 50% on health. So part of what we do is try as much as possible to encourage government to spend more money on health. And again, if you listen, if you ever interact with the governor at higher level, they will tell you a lot of responsibility that they have to, financial responsibility before them. But at the same time, part of what we do is to encourage them, to provide evidence, provide technical assistance, to make them to prioritize health in terms of spending higher percentage of their resources. But it's not only about spending more money. It's about the efficiency of spending as well.
Right, absolutely.
Yeah.
But I mean, I understand the point you're making, but is there a way that people can also be convinced through sort of education and so on to understand? Because I think part of the problem is that people only think of healthcare when they get sick. They don't think, right, I've got to invest in it. You see what I mean?
Absolutely.
So that when I get sick, there's enough there to go around. You see what I mean? They just think, well, I'm not sick. Why should I be paying 100 naira a month into some fund? You see what I mean?
Absolutely, absolutely. So again, there's the demand side of the problem in terms of a level of awareness, like a lot of interesting socio-cultural thoughts that comes when you encourage people to enroll for health insurance. Some people think that if I enroll for health insurance, it's a way of inviting disease for myself and all those stuff. Or religion,
Right.
my religion does not permit sort of insurance and all those stuff. But again, that's not the biggest problem. When people see quality care, they are willing to pay.
That's the point I was making earlier,
Yeah,
that we don't see the quality
exactly,
care anyway.
exactly.
Certainly
So-
not in public hospitals.
Exactly. So, in order to say quality care,
Right.
that's why we have this policy trust around health insurance scheme. Okay, there are different ways of financing health.
Yeah, you have to make it very quick,
Yeah,
because
yeah.
I want to get another question in before we have to go.
Exactly. So there are different ways of financing health. There is a way you finance health that you are just wasting the money. There's a way you finance health, you're going to get the best in terms of quality, in terms of efficiency. And that is the route of health insurance, route of what do you call, there's something called strategic purchasing.
Right.
Yeah.
And in terms of the starkness of this healthcare situation, the quest by the Buhari government to lift 100 million people out of poverty, it is threatened, isn't it, without adequate healthcare and access to it? Because people are going to keep falling below the poverty.
Absolutely, and I will give you a simple example. Imagine like an Okada rider that the wife's in a cesarean section. Probably the first thing that will even go is the Okada itself, because you want to pay for health. And when you pay for health and the Okada is gone, the means of livelihood is gone. Automatically, that's fairly in poverty. That's a simple example.
An Okada is a motorbike.
It's the motorbike.
It's a sort of motorbike taxi.
The motorbike taxi.
Right.
I'm just using that example
Sure.
because that's probably the commonest thing people can relate with in Nigeria. So that is it. And not to talk of millions of people that have cancer, people that have a kidney problem. You know, so it pushes a lot of people below poverty. And when I discuss with people in the policy arena, almost everybody is able to relate to a relative that has been that called me, a relative that need this, a relative that need that. A number of empowerment schemes that government put in place have vanished because when you empower somebody with 50,000 to start a business, and in this cesarean section with that is like 120,000, and there's no financial protection mechanism, the source of livelihood is gone.
Well, on that rather depressing note, I want to say thank you very much indeed, Dr. Gafar Lawode, who is the Country Director for Health Policy, which provides technical support to governments to help them progress towards universal health coverage, and will encourage you to keep doing more. Thank you very much indeed for coming in.
Thank you very much for having me.
That's it for this edition of the Arise interview. Join us again tomorrow from me and the entire team here in Abuja. Bye-bye, and thank you for watching.